Okay, good day everyone. Once again, my name is Vincent Madres Aguirre, and today we are going to talk about participation of private and labor sectors and DOLE. According to Goplerod and team on 2017, alcohol and drug abuse by employees cause many expensive problems for business and industry, ranging from lost productivity, injuries, and an increase in health insurance claims. So everything that is too much is bad for an individual. We must be responsible consumers and educate ourselves to be disciplined enough to understand that our personal health is important and needs to be prioritized. So now, let's talk about private and labor sector. So in a statement of Aguirre and Harding 2018, private sector participation in healthcare is a widely discussed subject that has been studied extensively. So private sectors should participate in healthcare and should manage to provide the consumers enough in the right number of products that are only needed so that the personal health of each and every individual will be managed and monitored. So another statement from Young and team on 2010 is that studies place considerable value into a multi-sectoral approach in order to maximize health gains in resources-limited areas, particularly low and middle-income countries. So the participation of the private sector in the health system proves valuable. So Philippines is considered as a low and middle-income country. That's why it is advisable that the approach is multi-sectoral. This is in order to maximize health gains. So in resource-limited areas, this will also lead into better health system. So another statement from Mugwagwa and team on 2010 is that evidence suggests that greater private sector participation in healthcare improves at least intermediate health outcomes, even in developing countries like the Philippines. So participation of greater private sectors should be improved ideally in developing countries like the Philippines because that is what things should work. Greater private sectors should focus in participation to economic growth and healthcare so that countries like the Philippines can cope up to the demands of the health and other consumers. As a funder of public HEI research, one of the barriers which hinders private sector participation is lack of support, incentives, and rewards for a public-private collaboration. Associating with industry or business is not often encountered because of the possibility of conflict of interest. Now, let's proceed to engaging with the private sector. So the Sea Oil Foundation, a fuel company with facilities in General Santos City, took an interest in tackling the illegal drug problem through their corporate social responsibility endeavors. So we were especially interested in rebuilding trust during the disruptive, divisive, and deadly context of the drug war, said Lorenzo on 2017, the Sea Oil Foundation Executive Director. General Santos City had used the Matrix in intensive outpatient program for the clients before 2019. However, clients were dropping out because of the length of the program. The city needed a CBDR program for low and moderate risk clients according to Porcelain and her team on 2017. She also wanted a grassroots-oriented program where barangays or villages could help service clients and their families. So now, let's talk about private sector, industry, and commerce, a work of Caliph and team on 2016. So first is we have promote only responsible, safe use of legal substances by adults. Companies that manufacture and sell alcohol and legal drugs, as well as products related to use of these substances, can demonstrate social responsibility by taking measures to discourage and prevent the misuse of their products. companies can take steps to ensure that the public is aware of the risk associated with substance use, including the use of medications with addictive potential alone and in combination with alcohol or other drugs. So the best example for this is a pack of cigarettes, which it is shown what are the possible effects of too much intake. Another one is alcoholic drink. So they say drink responsibility. This says that too much is not good to an individual. So next is we have support youth substance use prevention. Manufacturers and sellers of alcohol, legal drugs, and related products have a role in reducing and preventing youth substance use. They can discourage the sale and promotion of alcohol and other substances to minor and support evidence-based programs to prevent and reduce youth substance use. Example of this is when a minor buys a cigarette on a store. The staff would not allow since they are protecting the youth it will not lead into addiction. So last is we have continued to collaborate with the federal initiative to reduce prescription opioid and heroin-related overdose, death, and dependence. So pharmaceutical companies and pharmacies can continue to collaborate with the U.S. Department of Health and Human Services to identify and implement evidence-informed solutions to the current opioid crisis. This collaboration may include examining the revising product labeling, funding continuing medical education for providers on appropriate use of opioid medications, developing abuse-deterrent formulations of opioids, prioritizing development of non-opioid alternatives for pain reliefs, and conducting studies to determine the appropriate dosing of opioids in children and safe prescribing practices for both children and adults. Now, let us proceed to DOLE. In a statement of Harwood and team on 1998, illicit drug abuse often leads to significant personal and social consequences include labor market problems. Casual drug use versus drug use or drug abuse, however, has uncertain effects on job performance, especially consumption occurs away from the workplace and a relatively lengthy period of time between consumption and work. In Baguio City, since becoming Secretary of the Department of Labor and Employment in June 30, 2016, Attorney Sylvester H. Bello III, in support to President Rodrigo Roa Duterte's war on drugs, criminality, and corruption, and in response to the rising problem of alcohol and drug abuse in workplace, has directed all DOLE officers including regional offices, bureaus, services, and attached agencies to strengthen the campaign against illegal drugs and contribute to the President's effort to counter the country's drug problem. It requires the unified action of all DOLE agencies. Drug abuse is a serious problem that pervades all levels of the society, particularly the Filipino workers. So DOLE Department Order 5303 Series of 2003, otherwise known as the Guidelines for the Implementation of a Drug-Free Workplace Policies and Programs for the Private Sector, to assist both the employers and employees in the formulation of company policies and programs to achieve a drug-free workplace. So the department order was issued in compliance with Article 5 of Republic Act 9165, otherwise known as the Comprehensive Dangerous Drugs Act of 2002. So the conduct of the drug testing, however, should only be performed by duly accredited centers of the Department of H or the DOH, or Department of Health. So it is worth stressing that failure to follow the proper drug testing methods cannot be given credence and will result in illegal dismissal. Employees found to be positive for drug use constitute serious misconduct and may even be ground for termination of employment. In the same manner, an employee who refuses to undergo random drug testing may be guilty of insubordination for refusal to follow company rules and regulation. Under the law, these instances constitute just causes for dismissal. The task force, led by the Department of Labor and Employment, shall meet regularly in order to monitor the implementation of the relevant articles in the Comprehensive Dangerous Drugs Act of 2002, according to the guidelines defined by the IRR of Section 48 of the Law of 2016. It shall formulate the tripartite response to the law and provide strategies, directions, and networking to implement a national drug abuse prevention program in the workplace to be adopted by private companies with 10 or more employees. So all in all, a successful drug-free workplace is the cornerstone of a productive and safe place to work, and also comes with few more important incentives. According to the Balance Small Business, one of the most lucrative monetary incentives for employers to maintain a drug-free workplace is the opportunity to save money on workers' compensation premiums. So that concludes my topic. The next speaker will talk about the participation of LGUs. Thank you.